This microscopic view captures biological tissue operating in perfect synchronization, the same internal engineering that has powered human birth for millions of years. Yet, modern deliveries are frequently defined by stalled labor and high rates of surgical intervention. The mystery lies in why some bodies move through this process with seamless precision, while others face a sudden cascade of complications. This often points to a state of biological friction, where the body's own mechanics begin to work against the natural process of delivery. Research into these complications highlights two significant contributors to this resistance: physical immobility during the third trimester and the physiological impact of psychological stress. Identifying and addressing these physical and chemical blockades before labor begins is the first step toward a more efficient natural delivery. Fetal alignment is pure geometry. A head-down position allows a clear descent, but slight misalignment creates a spatial bottleneck at the pelvic exit. The uterus, a powerful muscle, relies on the pelvic floor and abdominal core for necessary delivery leverage. A sedentary lifestyle during pregnancy leads to a loss of strength in these support groups and a decrease in the flexibility of the pelvic ligaments. Without that flexible support, the uterus must overcome the resistance of a rigid pelvic structure on its own, which significantly stalls the baby's descent. This lack of movement effectively turns the birth canal from a flexible channel into a restrictive physical barrier. The cervix has one mechanical objective during labor: to expand its circular muscle fibers from a closed state to a width of exactly 10 centimeters. This expansion is a biomechanical requirement depending directly on the mother's ability to remain physically relaxed. But when the brain registers fear, these circular fibers involuntarily contract. The muscle locks in place, physically preventing the outward expansion needed for the baby to pass. This tension forces the uterus to push against a constricted opening, creating a painful stalemate between the body's internal forces. If physical tension remains unchecked, the natural opening process stalls, making labor longer and more difficult. These muscular mechanics are controlled by the endocrine system. Oxytocin is the hormone responsible for triggering and regulating the contractions that drive labor forward. But when the brain perceives fear, it triggers an evolutionary defense mechanism, flooding the body with adrenaline. This creates a chemical conflict. High levels of stress hormones bind to cellular receptors, as shown here, which blocks the production and flow of the oxytocin required for contractions. A state of severe psychological stress creates a systemic blockade that can effectively shut down the physical machinery of childbirth. In a high-friction scenario, an immobilized body under high stress faces a long, difficult labor that often necessitates medical intervention. Conversely, a body that has been physically prepared and remains calm uses its nervous system to facilitate, rather than hinder, contractions. Practicing daily walking and pelvic movements during the third trimester builds the anatomical flexibility needed for the baby to navigate the pelvis correctly. These differences in labor outcomes are largely the result of how well a mother has prepared to remove these biological sources of resistance. Posture also plays a role in the physics of birth. As this diagram shows, upright or squatting positions allow gravity to assist the baby's descent while naturally widening the pelvic opening. Controlled, deep breathing supports the process by maximizing oxygen delivery to the uterine muscles while simultaneously lowering adrenaline to protect oxytocin levels. The efficiency of a natural delivery depends on the active coordination of these biological and physical variables. By managing spatial alignment, muscle tension, and neurochemistry, mothers can work with their body's natural design for a safer and more efficient birth.